Okay. Everybody hear me? All right, so first I'd like to thank everybody for coming out today on this beautiful, lovely day outside. So, welcome. Anybody here for the first time? Just curious. Everybody's been here before? You have, first time. Okay, welcome, welcome. So obviously helping yourself to some food already. You found the free food. We have free samples, free literature. Help yourself. We have these events normally every 2 months, okay? But right now, due to the weather, this is our longest stretch. Well, we will not have another one till March, first weekend of March, okay? So March 7th to March 14th. So that's 3 months. 3 months. And then after that, it's every 2 months. Okay, so you just want to make sure you, if you are buying supplements, you get enough in order to take advantage of the discounts, which are pretty spectacular, the best in the country for you here. But my name is Mike Gallagher, for those who don't know me. Some of you I've seen many times, so good to see familiar faces. Hopefully everybody had a good holiday. So my little background on myself, first of all, I'm a certified lifestyle educator, okay? I've been in nutrition for almost 20 years. I'm only here during these wellness events to help answer questions, but normally I travel to all different types of healthcare practitioners. So I work with some medical doctors, I work with some DOs, I work with a lot of chiropractors, I work with a lot of nutritionists, pharmacists, naturopaths, kinesiologists, a few dietitians, homeopaths. So I work with a lot of different modalities, a lot of different ways of looking at your health. Okay, so I'm also work with psychologists now. I also work with certified hypnotherapists now. Okay, so a lot of different ways you can look at health. If you're interested in any of those specialties, if you're looking for anyone there, please see me afterward, and I'll give you some names and referrals there. If your doctor is interested in me coming to their office, okay, I'd be more than happy to come see them as long as they're open to listening, okay? So come see me afterward on that as well. Okay, so today Doc wanted me to talk about what I think is truly, of all the supplements on the shelves, and we have over 1,000 of them here on the clinic, I feel that dimethylglycine is absolutely the most important, the most valuable, does the most beneficial things, and we use it in a lot of our supplements as well. Not only do we have it by itself in a chewable or liquid, but we also combine it in a lot of our other supplements because it does so many amazing different things as well. But most people have never heard of the dimethylglycine. But it's not new. It's not new. It's actually been around for almost 30 years, DMG. Originally, oh, by the way, and this is something I personally take every day. So people always ask me, what do you take? This is definitely one of the things that I take every day since I found out about it about 4 years ago. 4 years ago. So I've been in the health field 20 years, and I didn't hear about it until about 4 years ago myself. So most people have never heard of DMG. Okay, so we're here to, make people aware, first and foremost, and let you know some of the different ways that you can use DMG as well. But a lot of work has been done by Dr. Roger Kendall. Dr. Kendall is a PhD in molecular biochemistry, and he basically spent his lifetime researching dimethylglycine. So when DMG first came over into the United States almost 30 years ago, it was originally called vitamin B15. So some of you might hear that name before, vitamin B15. Okay, they quickly changed the name to dimethylglycine within the first 2 years. Okay, so if you ever hear that name, B15, it is dimethylglycine. Dimethylglycine. It is found naturally in certain foods, but in teeny tiny trace amounts. So it's impossible to get enough dimethylglycine in your regular food, which is why you have to supplement to get the maximum benefit of DMG. Okay, so here's a small sampling, and you can follow along there with me in your handouts. But these are some of the amazing benefits of DMG. Number one, it improves oxygen utilization on the cellular level, puts more oxygen into your cells. Second, technically DMG is a methylizer. So we'll talk about what that means more in a moment. It has lots of different functions, but it also helps with detoxification on the liver, part 2 of detoxification, which is really critical when we're talking about detoxing your body. Third, it'll actually enhance and boost your immune system. There's a patent on that. I'll show you that here more in detail in a second. Next, it helps with all heart function, cardiovascular function. Next, it's an anti-inflammatory. You know, there's a U.S. patent on that. It's an antioxidant. So technically, that's how we classify DMG as an antioxidant. It will help with all brain neurological development. Okay, it will pass through the blood-brain barrier, which is, again, very unique, very rare. It helps with all brain disorders and neurological disorders. And lastly, but most important, it will help with cancer. In fact, dimethylglycine is the only supplement that I'm aware of in the United States that we can make a health claim to treat cancer with. DMG is the only supplement that we can say that about. And I'll show, and there's a U.S. patent about that, and I'll show that more detail about that as well. So for those who have not seen this presentation, if you've already seen this presentation, do not answer this, but for those who have never seen this before, out of all these things, and they're all important, okay? So there's really no wrong answer, but of all these benefits, what would you say is the most important on this list? Any guesses? Inflammatory, okay. Any other guesses? Liver function, okay. Any other guesses? Oxygen, okay. Immune, okay. They're all important. Again, they all have some benefit, extremely great benefits, all of them. But I would say if I were to choose one, it would be the first one, improving oxygen into the cell, because bacteria, viruses, and cancer cannot survive in an oxygen-rich environment. So the more oxygen you get into your cells, the better your health will be. And this is one of the few natural substances that it can actually do that, which in turn will help with all these other benefits as well. Okay? Now, if we break these down a little bit more in detail, athletes. So DMG actually goes back to the 1970s. Russian athletes were taking this as part of their top secret training program, along with a lot of other things, shall we say. But DMG is one of the things that they are famous for actually using for athletes. So it reduces lactic acid buildup, so you can work out longer and harder before getting that muscle burn. And then on the back end, it helps out with improving muscle recovery. And we actually use this in a couple of our sports nutrition formulas, which we'll talk about here in a moment. It's not on any ban list. Any high school can take this. Any college athlete, any professional athlete can take DMG. In fact, we work with a lot of professional doctors who work with professional athletes now. In fact, we work with over 50 current professional athletes out there in the marketplace, and a lot of them have told us taking our DMG has dramatically helped them. We work with triathletes and marathon runners who take DMG. They feel much better when they go through their racing, and on the back end they're not as sore after taking DMG as well. You're able to work out longer and harder and faster and so forth. For the heart, it actually has been shown to lower cholesterol. It has been shown to lower blood pressure, okay? For your immune, it helps with all different types of antibody response. We'll talk about that more in a moment. I mentioned viral bacterial infections it'll help out with. I should also say parasites. I should also say now Lyme's disease, DMG. Some doctors that I'm working with have told me that DMG is the only substance out there that can help destroy the majority of Lyme's. Medical doctors do not know this, okay? They do not know this. But DMG is one of the few things that, well, actually the only thing that's actually been shown to help with Lyme's. So if anybody in that situation, please see me afterward. I'll give you the whole protocol for that. Autism, okay? DMG is recommended by the National Autism Institute since the 1980s. And there are hundreds and hundreds and hundreds of studies for autistic children using DMG that's helped. Seizures as well, dramatic response with seizures. Any neurological issues such as bipolar, depression, anxiety, any of those things that this will help out with. I would also say Parkinson's as well. DMG will dramatically help with Parkinson's. Arthritis, joint issues. Any autoimmune issue, but especially lupus, but any autoimmune issue DMG will help out with. And again, the big C, cancer. DMG is the only supplement that we can make a health claim again with, okay? Very powerful. So that is a pretty amazing list of different things that DMG can do. And that's why we say if there's one thing that's called the magic pill, this would be it. Because there's no other supplement in the world that can help out with every single one of these benefits. Okay, and that's why you are using that heading. Now, the tricky part about DMG is the dosage. So we listed this, made this list here for you, and you can see, depending on the health condition we're talking about, you see a range, and it's from minimum to maximum here is that we're talking about. So a really simple, easy way to do this or figure this out is depending on your health issue. Okay, so just for basic preventative maintenance with us, it's just 1 a day. Okay, 1 a day. If you have any type of pain or inflammatory issue, it's 2 a day. If you have cancer, 3 a day. Okay, so it's 1, 2, or 3 a day in our chewables. Our chewables are 500 milligram strength. Okay, they taste like a cherry sweetheart. I'm just going to pass it around for you. If you've never tried one, please try it. Comes in a little blister pack. Okay. Okay.
You want us to try one?
Yeah, I'd love for everybody to try one. I promise it won't bite you. Okay. Tastes like a little cherry sweetheart. There's 60 in a box. So for most people have some type of inflammation, 2 a day. And we would recommend at least 1 in the morning and 1 in either lunch or in the afternoon. We don't want to take this later at night. We don't want to take this later at night because it might keep you, it might interrupt your sleep. Okay? Now, when people first try this, what some people tell me is they feel they have more energy. Okay? They have more energy. Other people, when they take this, they tell me they can think more clearly, kind of what they say, clearing out the cobwebs. Okay? That's the first time that they take this. Not everybody. Everybody's obviously different, but that's what people report back to me. And when I do this presentation in front of doctors, that's what they tell me by the time we finish talking. They actually feel a difference taking DMG. But when DMG first came out, it came out only in 100 or 125 milligram strength. Okay? So when we're talking inflammatory issue, we're talking, 1,000 milligrams. Most people weren't taking 10 of these out there. So most people, they didn't really see results of DMG. Also, people always ask, well, how soon before I see results? And again, there's a lot of variables going on. Number one is what you're eating, your diet. Okay? Are you exercising? How reducing stress? Okay? So those are always the things that we want to always do when we're combining any supplement to get the maximum benefit of any supplement. But typically 1 to 3 months. The majority of the studies that were out there on DMG was 1 to 3 months to get the benefits of this supplement out there. Okay? So we specifically made this 5 times stronger than any other DMG on the market. 5 times stronger to get the maximum benefit of DMG. Okay? So again, 1 a day for maintenance or preventative, 2 a day for any inflammatory issue or pain issue, 3 a day for cancer. Okay? Make sense? With me? Okay. Also, we don't mention it in the presentation earlier, but I do want to mention I've also had some fantastic results with diabetes and blood sugar with DMG as well. So I just want to point that out. That's some recent results that I've had doctors use that for as well. Okay, now this is how it works. So you might be saying right about now, how does one supplement do all these amazing things? How is that even possible? And this is how it's possible. So I try to think back to your chemistry days in high school, okay? So this is a very simplified chart of the methylation pathway. And this is happening inside your cell, in every cell in your body, every millisecond that this is happening, okay? And there's over 1 trillion cells in your body. But there's a whole series of conversions that takes place inside your cell. And these are your main conversions right here. There's actually 41 of them that takes place in a blink of your eye. So I'll try to keep this as simple as possible here, but when we take DMG, it pulls from your methyl donor in your cell, and it converts first into what's called sarcosine. Then it pulls from your methyl donor, then converts into glycine. Pulls from your methyl donor, then converts into serine. Then some of it converts into homocysteine, some of it converts into methionine, then to SAMe, then into homocysteine, then into cysteine, then into glutathione. Glutathione is your master antioxidant. That is your king or your queen, depending on your perspective, of all your antioxidants out there. And DMG is one of the few substances that you can take naturally that will actually increase your glutathione levels. Now you can go to a medical doctor and he will give you a glutathione drip intravenously. He will inject you with glutathione because he is not aware, or she is not aware, that you can actually take a supplement that will actually increase glutathione because they were never trained in nutrition, nor did they have any nutritional background whatsoever. So all they know is medication and drugs, right? So DMG will actually increase glutathione levels, which is why it has a US patent on it for boosting your immune system, okay? But everybody is imbalanced in one of these conversions. Every single person is imbalanced in one way, shape, or form. So just to give you a couple simple examples here. If you are poor serine methylator, if you're out of balance in your serine, this has been linked to neurological issues, ADD, OCD, okay, autism, addictions, alcohol addiction and drug addiction has been associated with this particular methylator, okay? Again, it's not, you're out of balance, okay? And DMG brings it back into proper balance. Homocysteine, cardiovascular issues, and doctors are testing for homocysteine levels now, okay? And they'll tell you if you're out of balance or out of, if you're under or over. DMG will help with homocysteine, okay? SAMe, which we do sell SAMe by itself now. SAMe's been around for many years as well. SAMe is more for stress, anxiety, okay, depression, joint pain has been associated with SAMe. And by the way, some of the newest research on SAMe that has just come out just a few months ago has been linked to concussions and post-traumatic brain issues. So again, you can focus just on that one methylator, or DMG actually helps with all of them all at the same time. And then lastly, cysteine. Cysteine is part of your detox. So I use the example of people who drink coffee. Some people can drink a cup of coffee before they go to bed, no problem sleeping. Other people drink a cup of coffee and they're bouncing off the walls for the next 2 days, okay? And again, some people like that, but this is why that is happening. You are out of balance in this particular methylator. So DMG brings it all back. It just rebalances all of these methylators all at the same time. And there's no other supplement in the world that does this. There's none. That is what is so amazing about DMG, okay? Now, methylation is just a fancy word for absorption. So if you're using any other supplements, it will enhance and make those other supplements that you are taking, it will make them more efficient and more absorbable. And you will get faster, quicker results with those other supplements, which is why we use it in a lot of our other formulas to make them even better, okay? Which is fantastic. If you're on any drugs, medications, okay, it will not interfere with any medication, but it will enhance that medication and make it more efficient And as you're working with your prescribing physician, as your condition improves, then you need less and less of your medication to none at all, which is the ultimate goal that we always strive for, okay? Again, that is what makes DMG so unique. So this is a very complex that I'm really simplifying, but does that make sense to everybody? Everybody with me? Yes.
DMG helps medicines absorb with one risk overdosing?
No, that's why you're working with your prescribing physician, and as your condition improves, then he can use less and less of the medication.
I meant initially.
No. No, because again, it takes a couple months for this to work. Yes. Okay. Any other questions?
If you were taking that Immunomax,
Yes.
how does that help that?
Well, Immunomax DMG is in Immunomax, so again, we put that in there, but we add this. You can add to this.
Also added to,
You can add this to make the Immunomax even more effective, which by itself it's more effective, but this will just enhance it. Yep. Anything? Any other questions? Okay. So we have a book here, and some of you, we do sell it here. So Dr. Kendall wrote an entire book about DMG. So it's very rare that you see a whole book dedicated to one supplement, but you have that in DMG, okay? This gives the whole history of it, how it was founded, how they discovered it, how it was introduced to the United States, and he broke it down by different chapters. So there's a chapter just on cancer, there's a chapter just on autism, there's a chapter on immune, you name it, he breaks it all down here. What I like about it is a couple things. Okay. So on page 193 is the actual dosage range that we just went over, okay? But if we go to the very back of the book, under references, you'll see under references, there's page after page after page after page after page after page of studies, okay? And what's the one thing that medical doctors like to say about supplements is that there are no studies about them. So if I am able to speak to a medical doctor about this, I give them this book and I show them this exact references. And I say, Doc, do you want those studies alphabetical order or top 100? And then they don't say another word, okay? They just aren't aware. They're just not aware of natural ingredients that can help people. So that's my job, is to make them aware. So I'm just gonna pass that book out for you. It's a fabulous book. I encourage you all to check it out. Once you start reading it, it's almost impossible for you to put it down. And it's just unbelievable with the amount of research and studies on DMG. Okay, so with the time remaining, I wanted to share with you some of the patents. Okay, so first of all, first one here goes back to 1991. U.S. patent for the treatment of arthritis and inflammation using DMG. So let's think about that for a second. So that is a health claim on a natural substance, okay? There are no other supplements in the world that we can make a health claim for, but we can with DMG. Now you might say, how is that possible? Well, the manufacturers of DMG fought the FDA, the Food and Drug Administration, our buddies at the FDA, and they actually spent millions of dollars fighting them, and they actually won. They beat the FDA. So, DMG is not a vitamin, it's not a mineral, it's not a fish oil. It's on its own little world, own little planet. So that is why we can say things about DMG we can't say about any other supplement, okay? So that is as strong as it gets. So any other supplement has to have that disclaimer, you may not prevent, treat, or cure disease. We do not have that disclaimer about DMG because it has been shown to treat and cure disease. It has. Again, if you show that to a medical doctor, their jaw hits the ground. They are stunned and shocked. And so, if you know anything about you having a U.S. patent, Number one, costs a lot of money. Number two, you better have the studies to back it up. And again, there's hundreds and hundreds of studies. We're just going to share a couple with them here, a couple bullet points. It's been shown to have all different anti-inflammatory properties. It's been shown to reduce all these different anti-inflammatory markers in the cell. And these are the same markers that drug companies test for in their studies. That DMG has shown the same results. Of course, there's no side effects in DMG. It's reduced inflammation in animal studies. Okay, and in the past, we would recommend, if you had arthritis, we would recommend DMG, fish oil, HA+. But now we have the X-Flame, and the X-Flame has DMG in it, along with another patented ingredient called creselazine, along with a lot of other natural anti-inflammatory herbs that have been used for centuries, like turmeric and boswellia. So X-Flame takes the DMG concept even further and higher, okay? So again, that's the whole evolution of where we've come with DMG. We're just adding other ingredients to it to make it even better. And the X-Flame right now is actually 50% off this week, so it's a really, really good value for you on that. Here's another study, an animal study. So we have DMG on top, control group on the bottom. DMG actually reduced pain inflammation almost 3 times as much as the control group. Okay. Second patent, this is more recent, this is 2007, it's a 2-parter. So, first part, methods and compositions for modulating immune response, which is a fancy way of saying boosting your immune system, and for the treatment of all inflammatory disease, which every chronic health issue is inflammation. So to have a U.S. patent to treat a natural substance to treat all inflammatory disease, again, it's unheard of. DMG is the only supplement in the world that can make this claim, okay? That's how powerful this is. So let's go back to the immune one here. So you see the this study here was looking, it's broken down into 3 different groups. Normal patients, first 3, second 3 were sickle cell patients, last 3 were diabetic patients. And you see the lymphocytes, the T cells, okay? Before DMG in yellow and blue, after DMG, every single group showed significant improvement. In fact, if you average all of them out, averages 400% increase in T lymphocytes, which there's no drug in the world that has shown that kind of improvement in your T cells, okay? So this is why we recommend it for cancer patients, and I have some doctors. And this is why we have this in the Immunomax. So the Immunomax takes the DMG concept even further with not only DMG, but also 2 other patented ingredients as well to boost your immune system. Seizures. So this is an incredible study with seizures. So look at the date on this. This goes back to 1982, published in New England Journal of Medicine, which is the holy Bible of all medical doctors. When they do studies, that's where they publish them, in the New England Journal of Medicine. When they do speaking talks, they refer to their studies in New England Journal of Medicine, okay? So when I show this to a medical doctor, they can't say anything because it's in their own journals, right? They just never heard of this study. No one's ever showed it to them before. So this goes back, in the study, this group was averaging 17 seizures a week before DMG, okay? Within 2 weeks, taking 1 a day, they went down to 3 seizures, from 17 to 3 in 1 week, or excuse me, 2 weeks. No side effects, no contraindications. They maintained that till week 5. At week 5, they stopped the DMG. It came right back to where it was normally, 17. 2 weeks later, it started again, went right back to where it was, 3. At week 11, they increased the dosage. In this case, it went from 1 to 2 a day, and it went down to 1 seizure a week, okay? At week 14, they stopped it. It did come back up, but not as bad as it did originally. The next week, they started right back, and then for the next 20 weeks, it maintained at 1 seizure a week. 1 seizure a week. Now, I had a doctor here in the area that I showed this study to, and he had a patient who was averaging 80 seizures a month, 80. I showed him this exact study. He had the patient pick it up, 2 a day, 2 DMGs a day, went from 80 to 0 in 1 month, 30 days. So I've seen this firsthand. So again, I know seizures maybe not your specific issue, but if you know anybody, family member or friend, please show them this. This will save and change their life. I promise you, DMG will. Okay?
This includes epileptic seizures?
Yes,
Is that what you're talking about?
yes, all seizures, all seizures. Again, with, yes, question.
Would this help the children that are waiting, that are trying to get the medicinal marijuana approved, that's been helpful to them?
Yeah, very interesting. DMG works on the same methylator as the medical marijuana does. Okay, so let's go back to that methylation process. Again, medical doctors are not aware of this, but this same methylation process is very similar to the medical marijuana aspect of it. And again, there's THC and the other form of marijuana that doesn't get you high, but that form works on the same methylation pathway. So yes, this will do the exact same thing as the medical marijuana will do for seizures. It will dramatically change their life. Absolutely, great question. Again, most medical doctors do not know that. Okay, autism. Autism. So again, this might not be your situation, but you might know somebody who has autism. Latest stats, 1 in 60 children right now born in the U.S. have autism. 1 in 60. 10 years ago it was 1 in 10,000. It's 1 in 60 right now. So, it's a very sad situation. DMG recommended by National Autism Institute since the 1980s. Since the 1980s. There are hundreds and hundreds and hundreds of studies that show DMG will help. Here's just one that we picked. Goes back to 1990. 80% of autistic children showed improvement taking DMG. By the way, that was within 30 days. 30 days. Okay? Here's another one. We have many, many. Here's another one. All same. Improved communication, better social interaction, reduction in irritability, lethargic hyperactivity, all taking DMG. Okay? And then last but not least, cancer. So this is a U.S. patent on it, 1991. Look at the date. 1991, treatment of melanoma using dimethylglycine. Okay, now melanoma, of course, is skin cancer. So that's actually the U.S. patent on it. That's what we can make the health claim on, skin cancer, but we use this with all cancers, okay? All cancers. And skin cancer is one of the most challenging cancers of them all. But, we use this with everything. But very powerful. So it's been shown to help in animal and cell culture studies, both prevent and even reverse cancer. And we've had some incredible results with animals using our liquid DMG with cancers and tumors. So obviously, again, to have a patent on it, you better have the research, which there is plenty, but I'll just share with you one here. So this was a study where they induced tumors in the chicken embryos. So you see before in yellow, the tumor size, before DMG, in blue is after DMG. Result there, 60% reduction in tumor size. Okay, so it's one thing to see a bar graph. It's another to actually see the tumors themselves. So this is where they induce them right there. You can see the green arrows pointing to them. Okay, this is before DMG. This is 3 months later, 90 days. 90 days. Okay, so we've had some incredible, incredible results. Now, DMG is not the only piece of the puzzle. With cancer, we want to make sure we emphasize this. There are multiple things that we would recommend, many, many different pieces to the puzzle, and it all depends on what type of cancer that you have. But DMG would be at the top of the list for you if you were willing to take a couple things. Supplemental-wise, DMG would be absolutely at the top of the list there for you on cancer. Okay? Any questions on that at all? Yes, sir.
Have a question to you. You have a tough situation here because you're trying to convince people that are schooled by the pharmacies,
Right.
and then they some of them don't want any parts of vitamins.
Sure.
So how do you
You ask them, doctor, how open are you to supplements? If they're not, I find a new doctor. There's a doctor in every corner. I have several names I can give you, medical doctors that are open that I do work with nutritionally. Okay? It's unfortunate here in the Pittsburgh area because of UPMC. UPMC has created a tremendous divide with nutrition. It's in their contract, UPMC doctors, that if they even mention supplements, they can be fired, terminated. Okay? So what's happened here is in Pittsburgh is called the Great Wall of China, created this great divide. Okay? So we can go to Cleveland 2 hours away, and they're much, much more open to nutrition and supplements than they are in Pittsburgh. Okay? So in Pittsburgh, they not only do they not talk about supplements, they bash them to death, unfortunately. But if we went to Cleveland 2 hours away, they're much more open to nutrition. But if we lived in California, New York, Florida, Chicago, Dallas, Texas, LA, San Diego, Oregon, West Coast, especially Arizona, they are much, much, much more open to nutrition. Okay? Just here in Pittsburgh, they're few and far between because of the politics and people involved at the hospitals. Okay? So I only talk to people who want to listen. Okay? And so should you. It's your body, it's your health. Okay? The doctor's going to tell you what he thinks, but you don't have to follow him. That's why it's called a second opinion. Right? So, I can give you some names of some medical doctors just afterward if you come find me. Okay? Now, with the time remaining, just want to go over a couple things here, supplemental-wise. So, what we did is on the back, just go to the back of the handout. Okay, so we put the dosage on there for you. Also, the liquid. I mentioned the liquid is more for animals and infants and toddlers. Okay? So that's where the liquid would be hugely beneficial.
Is this more absorbable?
Not more absorbable. They're both absorbable. That is just recommended for animals, especially dogs, and also for babies and infants and toddlers. You can't do the chewable.
For animals, why?
For cancer and tumors, which we have had numerous benefits for on that. Okay? Okay, so I'm just going to give you a couple things that we have now in DMG in. So we've created that flyer on the back. If you flip it over inside out, there we go. Yeah. Okay, take the back page and just flip it over. Make sure so it's inside. We listed a lot of the different supplements that we're now using DMG in as well, because we think this is such a valuable supplement. So Air Max would be for seasonal allergies and sinus issues. Okay, it works faster than Benadryl or Claritin. Okay, without any side effects, no drowsiness. Cardio Stack would be for any heart issues, heart patients, especially AFib, if you've had a stent, heart attacks. That's where the Cardio Stack comes into play. GI Complete would obviously be for any GI stomach issues. Immunomax for any cold and flu season. Power Fuel is like a pre-energy workout drink, also excellent for the heart. We use it in all of our fruit and veggie drinks, the Pro Oranges, Pro Reds. Power Q600 is our CoQ10, very super strong dosage. And then the X-Flame would be, again, as an anti-inflammatory, like pain, like a natural aspirin. So all those things have DMG in it. And again, we're just enhancing the whole DMG concept with those other ingredients. Okay? So, any other questions on anything? All right, folks, thanks so much. Appreciate your time. Have a rest of a great evening. And I'll be back at 3 to talk about eye health.